Good morning. Welcome to Advanced Life Support course. I'm Dr. Luah. This is an introductory lecture of Advanced Life Support. Besides the core knowledge of resuscitation, there are many other information you may need to know in order to understand better why do you need to do Advanced Life Support, how to learn, and when to perform. This will definitely help in terms of your patient's management and also taking care of your own well-being. These include history of resuscitation science in Malaysia, the differences between advanced cardiac life support and advanced life support, what is ILCOR, what is ANCOT, and what do you understand about effective team dynamic in advanced life support, resuscitation in COVID-19 pandemic, and the ALS course syllabus and assessment. Before starting the course, I normally ask the participants what's the difference between advanced cardiac life support and advanced life support. Many of them think that advanced cardiac life support is superior to advanced life support. Before knowing the answer, one should understand what are the missions and objectives when MOH training the participants for ALS. Because the main objective is to make sure we want to train the first-line rescuers to be able to resuscitate and maintain the collapsed victim until the definite help comes in. We are not going to train you as cardiologists, and we are not planned to train you as anesthetists. We just want you to be safe rescuers. In 1986, CPR is introduced to Malaysia by American Heart Association. In 1991, the term of ALS is used to replace ACLS, knowing that more than 50% of our collapsed victims at A&E are due to trauma. So we don't want people to think that all this collapse is only due to the heart. And in 2006, ANCOT is formed at the MOH level. And in 2011, the first national CPR guideline is produced by ALS subcommittee. And at the same time, we also produce ALS Provider Manual 2011. 5 years later, when ILCOR come out the next national CPR guideline, ANCOT produced our ANCOT national guidelines in 2015 and ALS Provider Manual in 2016, and same thing happened to BLS subcommittee, in which BLS National Guidelines 2015 and BLS Provider Manual 2017. And this year, 2020, resuscitation in COVID-19 pandemic, the interim guidelines was produced by ALS subcommittee. What is ILCOR? All of you should know ILCOR because this is the most important national resuscitation organization worldwide. It's formed in 1992 and the members include American Heart Association, European Resuscitation Council, Australia-New Zealand Resuscitation Council, and Resuscitation Council of Asia, etc. The mission of forming this ILCOR is to make sure to get more evidence-based medicine based on the research and in order to improve the resuscitation outcome and patient survival. And what is ANCOT? ANCOT means National Committee on Resuscitation Training, formed in 2006. And there are many subdivisions in ANCOT, include Advanced Life Support Subcommittee, Basic Life Support, Trauma Life Support, Pediatric Life Support Subcommittee, Neonatal Resuscitation Program Subcommittee, and Training Subdivision. The main purpose of forming ANCOT is to standardize the training in this country. Now, why do you need to learn advanced life support? You know, from a patient collapse until possibly the patient has intact neurological survival, advanced life support play the most important role. Of course, in between, one should maintain the change of survival and has an effective team dynamic in order to get a successful outcome. In all the resuscitation team, there should be a team leader and many team members. Team leaders are the one organize the group monitor the performance. He or she should be the one able to perform all the skills, direct the team members, and provide the critic post-performance after the resuscitation effort. And team members should understand their role, willing, able, and skilled to perform the role, understand the ACLS sequences, and be committed. In order to achieve the successful outcome, clear communication is essential, and all the communication in the resuscitation should be directive, precise, and one at a time. So effective team dynamic in any ACLS team will include respect team members, constructive intervention, closed-loop communication, use a common language and active listening, and knowing well, follow rigidly ACLS algorithm. In this resuscitation, in COVID-19 pandemic, is there any difference? Of course, there's not, because we're still using the latest ILCOR treatment recommendation CPR guideline. So, what are the worries? One should understand there are a lot of clinical concerns for this resuscitation during this period, because CPR involves numerous aerosol generating procedures, for example, chest compression, positive pressure ventilation, and establishment of advanced airway. And every CPR will include many resuscitation rescuers, and social distancing may not be easy to maintain. And this is a very high stress emergent event. One should consider effective infection control practice, but that is not easy. So in order to achieve maximum resuscitation outcome and also to take care of own well-being, the balance point need to be careful and need to be done properly. There are ethical issues in this case, but one should remember there's no emergency in pandemic. Stay safe, do no harm. So all the rescuers should have full PPE when do resuscitation. What do we mean by PPE? Means personal protective equipment. This includes respiratory protection, at least an N95 mask. In a known case of COVID-19 positive case, PAPR may be required if you have. Eye protection like goggles or facial, glove, isolation gown, head cover, shoe cover. This should be available at the resus trolley for every case preparation. So, like I said earlier, in all the CPR cases, N95, eye protection, glove are mandatory. Come back to our course syllabus. ALS is a very intensive course that includes core lecture, skill teaching, and exam. Lectures will include airway management, arrhythmia, algorithm, drugs, and post-cardiac arrest care. You need to know ECG, you need to know how to handle electrical therapy. And skill station is airway skill station and mega code, in which you'll be given case scenario. Exam, we'll have theory exam and skill exam. So how are you going to be assessed? Test component in ALS, theory, there are MCQ and ECG paper. Scale, airway, defib, and mega code. How to pass? I think this is the most important questions that people will ask. MOH minimal requirement is 75% of the passing marks. MCQ more than 75%, ECG more than 75%. ECG you have 20 questions, so means that you must pass at least 15 and above. Airway station, all in lung phenomenon, you know or you don't know how to perform. And case scenario, if you think end of the day you kill the mannequin, I don't think you deserve to pass. So how is it going to be conducted in this pandemic era? Now we conduct 2-day courses because ALS, based on a national resuscitation policy, the requirement is minimally 16 hours. So day 1, we will start with pre-test, followed by lecture, and end with theory exam. Theory exam, you got to come over to the skill lab for it. Day 2, and whoever passed the theory exam, you'll be invited for day 2 practical session. Morning practical and afternoon exam. How's the certification criteria? Be aware that this ALS certificate is valid for 3 years. Certificate will be given if you pass all the components. That includes a skill station, mega code, and theory test. If you pass theory with the flying colors, but you failed the skill station, on the same day, you'll be asked to resit the exam and probably send you to the different station because some station may have very fierce examiner. Alright, then the theory passing score, like I mentioned earlier, 75% of each. If you fail the theory, you no choice to resit the whole course again. We will call you for the next ACLS. With that, thank you so much.